Hi everyone. Good evening. Welcome to the. I'm actually losing count of how many episodes we're on, but that means it's a good thing. So welcome to Black Health Unfiltered. My name is Dr. Hakeem Short, and today we have a wonderful opportunity to really investigate a term that I like to call beyond the scrubs, where we dive into the reality of Black professionals. But today we're going to look at the reality of nurses and what they would have to go through as Black professionals within that medical field. As I said, my name is Dr. Hakeem Stewart. On the 30th of November, 2025, there's a lot of things we have to speak about. Some things we got to pay attention to, like as we're still trying to help our brothers and sisters and neighboring countries of Jamaica and Jamaica themselves that would have been or would have suffered by the hands of Hurricane Melissa. So those up there that are listening, please, if you can, donate whatever you can, whether it be non-perishable items, whether it be money to respectable or reliable organizations to help those in need of all those different countries that would have been affected. Please, it's always good to lend a helping hand. Also, today, I'd like to put out there happy independence to Barbados. I am a Barbadian native and I would take this opportunity to give my country a little bit of spotlight. Today is our independence as the Republic of Barbados. So, those who are from the country of Barbados and are listening or have some Bajan heritage, or if you have a Bajan friend, please give them a shout out. Let them know we're very proud people. So it will be really, really appreciated from my aspect. And also, too, I wanted to give a little bit of like to Love Bay's fourth annual children's gift giving event. It's happening Saturday, December 6th. So that's next Saturday for those in the Ontario area from 1 p.m. to 4 p.m. This will be done at Bladen Public School, which is 25 Bladen Avenue, North York, Ontario. That's 25 Bladen Avenue, North York, Ontario. And it's going to be a gift given for children. All children must be registered. So if you get an opportunity to go on Love Bay, to look out, check their social media pages, and you could get more information. But if you're going to be there, all children must be registered and in attendance for you to get your gift. So it's Christmas coming up. We all want to have enough stuff, a lot of stuff under the tree, and it's a great opportunity as a charitable event to give back to the kids. If you need more info, you can reach out to 437-778-3299. That is 437-778-3299. So now, today we have the opportunity to really listen and get into our podcast, which is Beyond the Scrubs. So I have the special opportunity, well, the pleasure, it's best said, to introduce two of some of my favorite people that I've had a chance to get to know over the past year and a half. It feels like so much time since we've clicked. I've worked with them through the Black Nurses Leading Change organization here in Ontario, and I'm just going to start off by introducing Donna Lawrence, who is a palliative pain and symptom management nurse consultant. Donna is a seasoned registered nurse. She completed her Bachelor of Nursing at the University of Manitoba in 2010, graduated with a Master of Nursing degree from Athabasca University in 2022, and a Canadian Nurses Association specialty certification in hospice palliative care in 2023. Her career in healthcare spans over 2 decades, beginning as a personal support worker and evolving through roles in as an RN, nurse educator, and director of care. Donna has worked in hospital, home care, education, long-term care, and hospice settings. Currently, she serves as regional palliative pain and symptom management consultant and secondary level expert in hospice palliative care. Donna provides foundational palliative and end of life education to health professionals and consultation guidance to long term care homes and community teams to strengthen their palliative approach across Waterloo and Wellington. Her work is grounded in a deep commitment to improving the equity in access to healthcare and quality of life across the lifespan while ensuring dignity and compassion throughout the end of life journey. She's a passionate advocate for health equity and policy change, serving as the Policy and Political Executive Network Officer for the Registered Nurses Association of Ontario interest group, Black Nurses Leading Change, for the past 4 years, and served as a director on the board of the Home Hospice Association for the past 3 years. Secondly, we have I have the pleasure of introducing, and we have the pleasure of welcoming Dwight Barrett, who is a dedicated critical care nurse with extensive experience in intensive care, emergency medicine, medical surgical care, and mental health at Trillium Health Partners. Throughout his nursing career, Dwight has taken on a variety of leadership roles, including charge nurse, team leader, clinical lead, clinical facilitator, and preceptor. He is currently part of the critical care response team, where he provides specialized rapid response care to critically ill patients. Dwight is currently pursuing a master's in nursing with a focus of health policy and leadership at Toronto Metropolitan University, furthering his passion for advancing healthcare systems and shaping future nursing practices. In addition to his clinical work, Dwight is deeply committed to education. He serves as a clinical instructor, lab instructor, and lecturer for the PSW program at Humber College, where he mentors and inspires the next generation of healthcare professionals. In recognition of his outstanding contribution to healthcare leadership, Dwight was recently awarded the 2025 Emerging Leader in Healthcare Health Heroes Award. He's also actively involved with the Registered Nurses Association of Ontario, serving as Communication Executive Officer for the Black Nurses Leading Change Interest Group and as a Social Media Executive Officer for the Men in Nursing Interest Group. Beyond nursing, Dwight is a mentor, a self-published author, with one book published and 2 additional works set for release. His career reflects a strong commitment to excellence, leadership, and empowering others in healthcare and beyond. So we take the time to welcome Donna and Dwight.
Hi. Man, you make
Hi
it sound
guys, how are you
so
doing today?
good.
I know. I was like, was that us? What?
It's really good. Oh,
I
sorry
was
guys.
like,
Let me
damn.
take a second. Someone, I'm losing you here on my end for sound, and that's all on me, not on you. It's all on me.
Okay.
Yes, I believe I can hear you guys now.
You
Okay.
can hear us now? Okay, good.
All right, perfect. So as I said, let me get an opportunity to ask again. How are you guys doing today?
Fantastic. We're here. We're
Good.
so happy to be on your podcast.
Yep.
Especially I think we're either episode 9 or 10 because I've been listening over the last few weeks. So just amazing work that you're doing.
I need to take any opportunity with these because at the end of the day, like I'm gonna have to start thinking of when we get to the point that there are the milestones, right? You go in 10s, you go in 15s, you go 25s, and then all of a sudden we're at episode 100, like where has the time passed? All right, but I'm so
Yeah.
happy you guys could join me today and join our
Thank you.
podcast so we can be able to sit and actually get in because you guys have extensive experience, especially dealing with this system that we call the Ontario public system, health system,
Yeah.
all right?
Yeah.
So
hmm
we've had
I
the
think we're gonna. I
opportunity.
think we're gonna talk. We're gonna talk your ear off. I just have a feeling me and Donna are going to
Yeah, we're trying to
talk your
restrain
ear
ourselves,
off.
right?
We're trying to restrain ourselves right now. We're like, all
But
right,
but you know
when
what
we
it
listen.
is Black Health Unfiltered. So the point of the podcast is that, right? We get that unfiltered real truth for those who are listening to see what we really deal with, how we can give them all that information, that advocacy for them to push forward, right? We don't want to hide it. We don't want to keep any little things that we might find as secrets, but they're really not. We just need to have the public have that knowledge for them. So I'm going to start off a little bit just asking like the history of it, like what got you both into nursing?
Oh, into
And I'm gonna,
Donna,
nursing.
first.
Oh
yes,
boy.
let's start
Donna,
from there. I'm gonna start from
Donna, you go
Donna.
first.
Well,
Donna, you go
first
first. Ladies
off,
first.
it was there are nurses in my family, and I was so anti-nursing. I'm very headstrong, want to make my own decisions in life. Went into
Hmm.
corrections first as this 21-year-old girl,
Oh
and it
wow.
scared me. Not gonna lie. And
Did it?
it was all offenders that are 2 years less a day offenses, and even that scared me. So I kind of did my circuit of security work and working at Pearson with the X-ray scanners and stuff, and then was just like, you know what, there was at that time jobs were to get full time, really hard. So that's when I took the PSW program and started off on my journey in LTC. And then I ended up moving out of province and revisited security work again. I also did factory work and all of that stuff. That's why I know I'm not built to be working in car plants, but I did it for a while. And then I also went and did a paraeducator program to work as an education assistant with special needs kids in the Seven Oaks School Division in Winnipeg. So I had sustained that while I was doing my undergrad in nursing. I was involved in student council, and it's just that's really where that advocacy work really started. I got a part-time job in my undergrad working as a tutor in the Aboriginal focus programs through the University of Manitoba. So that's when Indigenous students from Northern Reserves would get flown into our satellite campus, and I would help prep them with any help they needed with writing, anatomy, physiology, and vigilating exams. So then that way, whichever health profession stream they went into, that they were prepared with their prerequisites. So that I was very passionate about. And then I finished my undergrad and moved back to Ontario, and the rest is history. Just really, really found my love and passion in education and hospice palliative care, and really took off with that.
Oh, that's a great.
That's a shortened version.
That's a shortened version, but at least it allowed you to get to the point of where you needed to be, right? It got to you. It showed you, because you were against it at first. You have nurses in your background, nurses in your family, but it's pretty good, like, to know that it took you, even though you tried to deny the pathway, the roads kept winding you back to the correct way that you needed to be.
I was like, no nursing, and I think a lot of it was I could not see myself in nursing. The people to which in those work environments, I did not see myself. I grew up in small town Ontario, right? So
You're an excellent nurse, Donna. You're an excellent nurse. You're an excellent nurse. Don't say that.
But I didn't see myself. And so in all of that, like, I did a whole undergrad degree, I did a whole graduate degree. I did not have one Black professor in all of that. So I really couldn't see, what specialty do I fit into? What is my heart's passion? It wasn't until getting all of these various work experiences in order to get full-time in nursing when I came back into the province in 2010, that's when the roots really started to grow.
All right. I like that. And how about you, Dwight? What got you into the advocacy of nursing? What really allowed you to get into this path as well? Was it as winding as trying to run from it, but every time you make a left-hand turn, it give you a roundabout back to the same path? Or was it more straightforward?
So, okay, let me try to make this very short. It's not going to be short, but I'm going to try my best. So first of all, my mom, when my mom came to Canada, in I think it was like in the late 60s, early 70s, she wanted to do nursing. So nursing, most West Indian, Caribbean parents, background families, there's always nurses regardless. So I've had aunts and so forth and cousins who are nurses till this day, and that is something that she wanted to do. So she never got the training to do it, but I remember growing up, she had, and I'm going to date myself, so anyone who knows these books, you might know it. There were these old school books. They were called You and Your Health. So it came in 3 volumes. There were these big blue books. I see Donna opening her eyes because she probably remembers the books. And each volume, like, one was based on family values. It was a social aspect. Then one was strictly about diseases, and the other one was about, and like, the anatomy. And as a 9, 10-year-old kid, instead of reading comic books, I was reading this book because I just had a passion. I just had this passion just for medicine. So I wanted to be a doctor. So went to high school, of course, got everything prepped up, prepared myself to go to university, and of course my parents, being typical Jamaican, it was like, pressure your book, and all that stuff. Got into university, and I think my experience at university changed me a bit because um, it was very social. I liked it, but for some reason I wasn't connected, and I wasn't getting the guidance. I just felt left out. Like no one was there to guide me. And as a Black man, pursuing in healthcare, it's kind of challenging because as soon as they see you, it's like either they're like, hey, let's do sports, or hey, let's take a musical career, right? So it's almost like you're kind of predetermined what to do, but if you want to do something else out of that, you're kind of left on alone to kind of do your own journey.
Mm-hmm.
So what ended up happening was I ended up doing I graduated from my university. It was like York University. And I was like, I still want to go into medicine, but I was avoiding all these hard courses. So what ended up happening was I decided to self-teach myself organic chemistry. Do not do that ever. That is a record. Yeah, don't
For
just
fun?
don't. Yeah, because when you're in your 20s, you can do whatever you want to do, right? So I was
That's
That's
like, you
very
true.
can't.
true.
No one can't tell me what to do. Blah 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 blah. But at any rate, long story short, that didn't go well. So I graduated from York University. I was also at the time working at Shoppers Drug Mart as a pharmacy technician. So I was a pharmacy tech for like 13 years. I also worked in the hospital. So when I didn't think that pathway worked, I thought maybe I could become a pharmacist. That didn't really work so well too, just because I've seen what pharmacists have gone through. So I said, nah, I don't want to do that. Then I actually discovered and looked into a career becoming, now in the States they have this. It's a certified registered nurse anesthetist. Up here we just have an anesthesiology assistant. But in order to do that, you there's two ways you can get into it. You can either become a registered nurse or you can become a respiratory therapist. Now I'm not gonna lie to you. I was very narrow-minded when it came to nursing. I thought nursing was strictly, women with the white caps on and bedpans, and I was very, very ignorant about it. It wasn't until a pharmacist said, "Don't be stupid. You would be a great nurse." And there's guys who are nursing and ignore the stereotypes. So I applied to both programs. I got accepted to both programs, but the RT respiratory therapist program was already full. So I would have had to wait till next year. So in the meantime, I got accepted to the nursing program. Went in, and what was a true game changer for me was in my second year. I was in a cardiology clinical placement, and my clinical teacher said, "Hey, do you want to visit the ICU?" I said, "All right, cool." So we went to go visit the ICU, and I saw pure guys there. Like I saw all these guys in scrubs and whatever. So I just assumed they were doctors or specialists. Come to find out, they were all nurses. So I was like, "Whoa, okay, this is interesting. This is where I can see myself doing this." And then the rest was history. I graduated. I became an extern, worked at Emerge for like 10 years plus. Then in the between time, worked, ICU, then transitioned after the pandemic to full-time ICU. Now I'm teaching and yeah, and then the rest is history.
That's good. And you see, I like how you look at it. You weren't too sure because you didn't know what representation was for you at that time. With males being nurses, right? I mean, I was going that, and then my dad was telling me, yeah, this nursing is good for everybody to get what you said. I said, right? And I had an uncle who also knew the law, the law, and TBI, mental health institute, and then others. There were nurses in that space early, like I said. And I've never, I've had the opportunity of seeing them, but you don't really see them, especially in Caribbean areas. You don't really see much, many nurses. So now you had the opportunity to walk into a space and you saw the representation that gave you the inspiration to follow through and the opportunity that you had sitting in front of you. Now, I want to put it like, is it the same way for when you look at persons that look like you? Not only just being males, and also the person looking at that, like black nurses. Did you get during that? Did you see black nurses? Did you see that? Like we hear some stories if you look in England, a lot of Jamaican migrants they went over there and they worked in healthcare, and there were a lot of black healthcare workers within that area in England. So there was some type of representation for the children to see and recognize. But when you got into nurses, did you see a lot of individuals who look like you?
Akeem, I don't know if that's your audio or my audio, but I'm hearing a lot of feedback.
Yeah, unfortunately, I couldn't hear any of what you just said.
Can you hear me now?
It's still garbled.
It's very static. But I know you mentioned about nursing in England and so far. I thought it was actually my headset, but it's
I'll fix it. I'm not too sure.
no problem. So while you're adjusting your audio, I guess Donna and I can just kind of Donna, you can hear me, right?
Yeah,
Can you hear me now, guys? Is it better?
it's still robotic. I don't know if you might have to like maybe like stop your sound and start it again. Or I don't know, are you using a headpiece or something, or like a because it
Can
could
you
be
hear me
your
now?
microphone setting or something. Okay, you sound better now.
You can hear me now?
Yes,
Yep,
Okay,
yep,
perfect.
perfect. Yeah, it has to be I with the headset. What I was trying to say, I'm sorry if the
yep.
sound was off. It was more of a case of now you had the opportunity to go into this space and you saw when you got into to see representation, specifically you, Dwight, and you saw males. And like growing up in the Caribbean, you don't see
Hmm.
many male representative in the nursing area. I heard about
No.
it when my father spoke to me because he had a stint as a nurse before he became a police officer, and my uncle as well. But that representation proved to be so important for you specifically. Now, when it comes to that aspect, and we turn around, we start to pivot, did it also play the same input as it would have for you as a black man, or for you, Donna, as a black woman? Did you see that same representation? I know, Donna, you mentioned that none of your professors at the time were black, right? But then how were you able to grasp inspiration to know that, okay, this is actually for me and I can actually still do this, right? Because sometimes you just need to see that representation for you to be able to step forward. Sometimes you have to know that there were people who before you were able to do it, or you have to then decide, okay, I'm going to be a trailblazer and set the pathway for everyone. And we know within Canada, they have a lot of trailblazers who were black women within the nursing sector. So then, how were you able to hone into that, or were you able to see that same type of representation in this day
I
and
would
age?
say my mother. My mother was a nurse's aide for 21 years, and so back in those days, the rules of long term care were not as restrictive as they were now. So I would go in and see her, and I would be allowed to help feed people in the dining room and various things like that. So it was through, the constant reaffirming that, like, because my parents immigrated here in, I believe, 1970, and then they ended up in Guelph in 1975. So it was just always, my mother very much was like, those spaces are going to be hard and you're going to have challenges, but just really, don't give up. There is a purpose for you, and your purpose is helping people, no matter which way that looks like. So I think without that encouragement, I don't think I would have kept pushing forward, because, as Dwight, many nurses leave within like the first 5 years of becoming a nurse. So I think that inbuilt resiliency, I know that's the buzzword right now, but being raised that way and having a strong and supportive mother really helped me.
Hmm. I would definitely agree with Donna. Especially well, for me, for like first of all, like being a black male nurses, we're a rare species, and I say that funnily just because already when you look into nursing, 10% of nurses, especially in the States and up here, are men. Now, out of that 10% of that are black men. So
Mm,
we're literally represent like 1%. So I rarely saw, um, did see people that was representative. And if I did see a black male nurse, 9 times out of 10, they were in psychiatry.
mm,
Mm.
So, and I think it's because, it's, well, we're big, black, and strong, so therefore we should be able to deal with like mental health patients and physical, et cetera, et cetera. No, that's not the case. That again, that's another stereotype. And even growing up in school, well, not even growing up, well, going to school, when I saw that, I want to change the narrative. So that's why I try to be in spaces that you rarely see us. To basically be like, hey, we do exist. Um, you do see us in Emerge, not that much in ICU. Like I think honestly, like even in my ICU, I think I might be the only one. There are guys up there, but I think I might be the only one. There might be another one, but no, there's two of us actually. But we want to be in spaces to show that we do exist, right? And it's you know, growing up going to school, I never saw that representation. So now me teaching, I want to make that difference. I want to be like, hey, there, we do exist. And I've had students come up to me, or my clinical students come up to me, and they're like, "Yo, like seeing you is a breath of fresh air because I don't see anyone representing us. I don't see anyone understanding what we go through or understanding how we think and so forth. And you connecting on that level makes a huge difference. And I think if we still encourage that, and this goes with even just Black individuals, period, in healthcare, the more we make a presence and the more we are out there, that we know that we exist, that we should be able to show, hey, we are knowledgeable in these spaces and we can advance and we can do good or even better than our counterparts. So it's always good to show representation. Yeah.
And I have to give kudos to Dwight, like for navigating that academic sphere because it is really hard to get in to
And we're
Yeah.
gonna and we're
anywhere
gonna talk
nursing
about that.
wise in that academic sphere to be able
Yeah.
to teach. Like I remember my one university interview where the person kept telling my friend I was a shoe-in, and then it was a video interview, and when you come on video and you instantly see the person's face drop because I don't have an ethnic sounding name. And then the conversation pivots to, I'm just going to run on this treadmill while I'm doing your interview. And then the entire rest of the interview was to justify why they were not going to pursue giving me the role because I don't have enough post-secondary experience, even though I used to teach PSWs at Conestoga College. And I teach health professionals. So that doesn't qualify me. So I gotta clap for you that you actually got in that spirit because it is very challenging.
It is very challenging. And just to make a quick tip, you guys can hear me good now, right? We all
Yes.
good. We are perfect.
Oh, we're good.
No, this is the day. This is I'm making sure this time for this episode we are on the ball for both of you guys, and I like to see the differences, right? Even though you guys are coming from two different aspects, two different approaches, the experience is still the same, right? You still have to deal with a certain level of systemic racism, still a certain level of stereotyping for the Black person, right? Like even that's because you don't have a Black sounding name, you show up and like, oh wow, I guess I think, and we know that that's a redundant way of thinking because you have so much to offer. If not, you wouldn't be getting these programs. Your degree is no different than the other person that did the same of a different ethnicity, but we still have to fight these battles. So, and I can imagine that's what inspired the Black nurses leading change.
100%.
So now I want to
Yeah.
actually dive in a bit to hear a little bit more because that's important. Regardless of, as you just said, right, 10% Black men, right? Donna, I could imagine that the percentage for Black women within the space will be higher, but
It'll
also
be higher.
it is still the same fight that will have to be within the systemic issues of what would be against Black women within the world itself. Now imagine now within that professional space. So it was obviously needed for you guys to create, or if not necessarily you, but be a part of such a movement to push forward for those within that space. And I've had the opportunity to sit down and listen to some of the conversations that you do have, and the community is strong. So what really does inspire, what has inspired, or what guides the true vision of the Black nurses?
Honestly, okay, so I gotta rewind a little bit here. And so during 2020, with the murder of George Floyd, and the RNAO, and under Dr. Doris Greenspun's leadership, they released a statement addressing the murder of George Floyd, the solidarity of the RNAO with Black nurses against anti-Black racism, and really to put a spotlight on injustice and mobilize and enact real change. So that stemmed to many conversations with Black nurses in the RNAO, talking about their experiences with ABR in workplace settings, academic institutions, professional associations, on and on and on. And that spiraled into the RNAO doing the Black Nurse Task Force report, which is absolutely amazing, highlighting all the inequities that is within our profession, and like really to take action and ownership to, how are we going to fix these problems? That then stemmed into the Black Nurses Leading Change Interest Group, which originally was chaired by Dania Versailles and Daria Judy Hope. And I joined probably a year into that inception. I think, Dwight, you've been on board for what, 3 years now, 2 years?
I joined, I believe in 2022 or
Yeah, but I
2023.
really joined
Yes.
because during during the time the Black Nurse Task Force report, I think just shortly before that, there was a series of webinars where there was discussion about the lack of leadership roles and the amount of masters prepared Black nurses that are still at the bedside, and that, trying to navigate into those roles and coming up again and again and again, not being able to find roles that and that are aligned with your graduate degrees is a real problem. And so that's why I joined. I really wanted to be able to speak with others that are going through the same experience. And how do we do advocacy? How do we support others? And so the BNLC really provides that support to our members. It's a safe place to come talk. It's a safe place to be able to figure things out. We host webinars, very informational webinars, like, how do you navigate those different pathways? What about self-help? What about resiliency? Like, all these things that really affect us. How can we make movement forward as a community, and how can we advocate for our people as well, right? And we also collaborate with other interest groups like the Indigenous interest group and the Rainbow interest group, and then there's the Health Consortium as well. So that's how it came to be. So right now our chair is Lori Zazzolato, and she's continuing to lead up the charge, as well as Dania helping as the past president, and her being on the past chair for the interest group, and her also being on the board of directors. So we're still continuing our movement. We did a mix and mingle in Toronto. We did a mix and mingle in Ottawa. So we brought the BNLC to our members as well, and we're still going. And so Dwight
We're
is
still
going
going,
to
yeah.
give you all the spotlights on the Black men in nursing webinar
Yes,
that we did, that has been
which is part
spiraling
of the
out to
interest
many
group.
great things.
That,
Right. Yes.
that, yeah, that's a
I want some input on that as well. Since you said it's such a small group, and I've been part of that. I've been within those discussions. How is it looking now for the Black men in nursing as well?
So, well, first of all, I do just a shout out to our BNLC, Black versus Leading Change group. Lori, Dania, Daria,
Iwana,
Kiwana, Kawal,
Nikki.
Nikki. Yeah, I don't think I forgot anyone. I think we said everyone else, including us. But I just do want to just say, they have been such a huge part of our growth. Um, they've almost been like they've been kind of like a family to me in the sense of like we've gone through a lot and we've just bounced each other's ideas. And Black Nurses Leading Change Group actually has inspired me to do so much, which led me to do Black Men in Nursing, the webinar series. So leading to that, how did that come about? Um, Basically, I think it came about. I saw I don't know if it was LinkedIn or Instagram. I saw some posting about um how few Black men were in nursing, and I just saw a couple of like young Black men in nursing who were on TikTok and Instagram just talking about their experiences, how you know families don't trust them, or they're always putting interesting assignments, or just stuff that made me just question, well, why are they being why is this happening to them? And then it made me even think deeper into thinking, well, does anyone know our experiences, our struggles, what we have to deal with, and so forth? So I said, you know what? I know a couple of Black men who are in nursing. Let me just reach out to them and be like, hey, um, would you be interested in just doing a webinar? Um, and I know Lori, shout out to Lori, she was all on it. Like Lori and Donna, they both were like, you need to do this, you need to do this, you need to do a webinar series, you need to just, it will be a hit. So we did the first one. Akeem, I think you were in for the second one, I believe. But the
I
first,
believe so.
they
Yeah.
were, yeah, but it was successful. Like it was very successful. So many people were asking questions. I remember even people in the comments, like in the Zoom meeting, they were like, they they didn't realize the stuff that we went through. They just never thought about it, right? Again, perfect example. Anytime when there's a violent or an aggressive patient, and I can say this from my experience, I'm always brought up to the forefront. Dwight, you deal with them. You're strong. Okay, so if I wasn't here, who would do it?
Mm.
Crickets. Or there's this situation. Oh, this patient weighs 300 pounds. Dwight, come help me reposition this patient. Okay, well, if I wasn't here, who would have done it? So I always have that reflect moment, and then also too, as being a black man in nursing, it's almost like you can't be emotional, but you have to be caring, and it's kind of weird because it's a struggle because you're deemed to be this big manly man, but then you have to show compassion at the same time. And if you're sensitive or if you show emotion, you're weak, you're this, you're that. So it just shows a lot of struggle, and especially with our mental health. This is one thing, especially with men, period, but particularly with black men, we don't talk about our mental health. I think the issue with us is that we're told to basically, keep quiet, do what you need to do, be a man about it, zip up your pants, and go about your business. The
Hmm.
problem with that, though, is that then we suffer from mental health, and then this is why you're in situations where all of a sudden you're hearing us depression, unaliving ourselves, et cetera, et cetera. And it's because we don't have those networks, we don't have those communities, we don't have those groups to talk about that stuff. So I figured, you know what, as a black man in nursing who's taking care of other people, we also need to check ourselves to see how are we doing, because we are exposed to a lot of stuff. And as much as we need to take care of the patient because the patient's obviously important, we also need to take care of ourselves too. So came up with the idea, worked really well. We're gonna go on for more series, and then also there is a special um, project that we're doing that should be happening sometime next year, Black History Month. So I won't
We're
give
looking
too
forward
much
to that.
details as yet.
We will be looking
Yeah.
forward to
So
that.
yeah.
All right.
Yes.
But you did mention something that's very important. I could imagine this is not only just a black men in total, because I would have been part of an event last Saturday, excuse me, here in Durham region, where we spoke about that and spoke about the importance of legacy and strength and within health and taking care of ourselves as black men. But I could imagine it equally for black nurses, black men and women as well, that the demand on you to have to
Mhm.
always do extra because you're expected to do more to be equal to your counterparts is a little bit, is
Exactly.
very tiring. So then how do you manage the idea of burnout within nursing? Like
It's hard.
and then
It's a lot of mental gymnastics.
and how do you do that?
Here's the
Because
yeah.
you're not just only doing the mental gymnastics through nursing and being a black nurse and what they would call gaps that would have not that been established for you within mentorship and different educational aspects where it makes it a little bit more difficult for you to go forward, but mainly having to do extra to be seen as an equal, where we tend to have to always do as black individuals in professional spaces, unfortunately, where it's overrun by other ethnicities and not those in leadership that look like us and understand our dynamics and understand how we work. So then how do you well, like, what solutions do you have for burnout? What solutions or how do you handle it? Or if you think that you could, if you had the opportunity to set standards for burnout within the space of nursing for black individuals, how would you approach it?
Oh,
Well,
you need
here's
to
the problem.
prioritize your own, you have to prioritize your own health and your own mental health, or you will be riddled with sickness. Hands down. You have to take care of yourself. You have to prioritize yourself. I don't care what anyone says, no job is worth it. You have to take care of yourself. Not enough is spoken, even to black women, about mental health. I used to really suffer from crippling anxiety just from all the different experiences I've had to go through, to the point where just working myself up to leave my bed to go to work became such a chore. And I went to see my family doctor about it. And right away, it was like, well, you can't get put on medications for that. Nurses should not be taking medications for anxiety.
Mm.
And it's
That's
like,
the problem.
wow, just like we don't get treated for pain properly either. So it's kind of like, how strong do you have to be in order to navigate this life. Like I didn't choose to be born melanated, but I'm very proud to be melanated, right?
Mm-hmm.
But it does come with a whole set of things where you have to think about every situation. Do I get frustrated in this situation? Do I say anything? If I do say something, am I going to be labeled as being aggressive? Am I going to be the angry Black woman? Am I going to be too sensitive? Am I playing the race card? Like, it is such defeating thing to have to sit there and overthink and actually have to be very political when you talk, because just about anything you say can be twisted the wrong way if someone has an agenda.
Yes.
Yep, I agree with that. And to go on to what Donna was saying too, what is it? What can we do? Here's a problem. we're not we're we're not encouraged to do that. We're basically have been like we're told not to do that. And if we try to do that, as Donna says, we're ridiculed, we're too mean, we're sensitive, we're overreacting. We don't have those tools. It's almost like it's a learning process. It's almost if you even try to take a mental health day or try to relax yourself, you get penalized or criticized in some way, some form. So it's a learning process. It's something that all of us as Black nurses we need to do that because, as Donna said very well, no job is that important for you over your health, right? Because job like once you go away, your job is replaceable, right?
Your
But I
closing's up the
find
next day. Even if your
exactly,
tombstone isn't
You
made,
might not,
your
you
job
might,
up.
you might
exactly.
even get the next day, you might by the evening, the HR already got it up and that's set to the
That's what
next
I'm saying. That's
week.
exactly. So it's like, but the problem for us, I think, because we have our own struggles on top of that, right?
Mhm.
And if we show that at work, it's deemed as that's your problem. You shouldn't be bringing your personal problems to work. So we're already having to put on, an armor suit of like, okay, I'm gonna not deal with my problems and I'm gonna take care of the patient. But then when you have problems at work and you've got issues to do at work, then it becomes a double standard. And then you're like, well, what do I do? But then I find we as a Black community, we were never encouraged to take time off, talk about your mental health, take a day off, do something. It's because we were always just been go, 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 go. And we've always been conditioned to not show any sign of weakness. But we can't do that. All we're doing is like killing ourselves. Like we're literally like making us running ourselves wrecked. And then now when we do try to find this help, as Donna very well explained, you don't need that. Why do you need that? As a nurse, you shouldn't do that. So it's like, damn if you do, damn if you don't. So it's really hard for us to try to figure that out. Um, I would personally say, I mean, for me personally, I do take time. I mean, I go to the gym. My wife and I, we do spa days or spa every so often. We go to a spa. There's times when you need to just wind down, and it's okay to be like, I don't want to deal with you right now. I need time for myself. We are all human, right? But it's funny. We're all human, but only certain of us get the preferable treatment, and others are like, well, no, you just deal with it and you just keep on working,
That's
and
why it's
that's when you get
important.
burnout.
So that's why it's important for community and the community that
Yeah,
you're Black nurses even change, coming together, having the opportunity to speak about
Your
these
mic's
issues.
doing that thing again.
yeah, your mic's.
Sorry to cut you off, but
But while he's fixing that, but yeah, that's pretty much what's been the struggle for us. And Donna, I mean, you went through a lot, and I mean, kudos to you.
Can can you hear me
Two.
now?
yes.
Yep, we
Yeah,
can hear you
perfect.
now.
Yeah. So that's why, no, I say that's, I'm so sorry about that, but that's why it's important that you have the community with the Black nurses leading change. You have the importance of coming together and speaking about all of these things that you guys face with persons who look like you, understand you, not only from the professional aspect, but from the lifestyle and the personal view that people may have on you. So, and if the healthcare system really did truly listen to Black nurses, my question would be, what would be the first change that they should make? Because you spoke about all these things that affect you, and the community that you guys are building is great. That's awesome. And that's what could really help you guys escape the ideas of burnout, right? or if not necessarily escape it, but be able to rely on and create the support system that is needed, right? Community, so you're not pouring from an empty cup. But hearing you speak, there is a need for the system to listen to what Black nurses are saying. So if you
Okay,
had an
so
opportunity,
I can give an example. Okay,
watch the
so in the
change.
medical field,
Hmm.
they say pain is whatever the person says it is.
Hmm.
How come that does not apply when it comes to Black people?
Because apparently black people we are apparently we don't feel pain. You didn't know that? Apparently we don't feel pain. The black woman is black women apparently have a very high pain threshold. I don't know where that stereotype came from,
I think
but
But we know,
that
we
I
all
think
know
that
that the
that's
medical
insane.
system was not developed with us in mind, right? The imagery of what is the Black experience was not developed within the medical system. We were more or less a lot of test subjects for a lot of these
yep,
successful, innovative procedures. We were test subjects. So
most
no, when
definitely.
we look at it, no, see if we had the opportunity to sit down, hey, as a Black nurse, I need what, right? Give as a Black nurse, I believe you guys should change this. If you had that opportunity to sit down at that table and actually speak with them, like what would you tell them as a Black
Oh my
nurse?
gosh, there's so much.
I
There's so
know.
much. Like
I could imagine, and
how
we
can
could
you have Black women that die during delivery, or 3 to 4 times more likely to die while delivering their babies, but then we don't collect race-based data when it comes to delivering babies in this country.
Hmm.
It doesn't make any sense.
It really does
I
not.
will say this.
I
I will
almost
say
died during
this.
my delivery too.
Oh wow. I
Wow.
will say this. I will say as far as what can be done. First of all, listen to us. Just listen to us. Listen to us. If we're talking to you about an experience or something that we're going through, we're not doing it to chastise you. We're not doing it because we're bored. We're not doing it to gain brownie points so we can be likable. We're doing it because we have an issue and it's bothering us. So first step, listen to us. Second of all, our experience is our experience, and don't dictate to us and tell us that our experience is not correct.
Hmm.
And I say that because, especially when it comes to nursing care, if I'm providing nursing care to an individual, and if I feel that this person does not, for whatever reason, does not want my care because I'm black or whatever the case may be, if I am telling you that, I need you to listen and I need you to understand why, and just don't go quick and just go take the patient side. Because I've seen that a lot of times where I've had I've seen family members not want a black nurse for whatever reason, and clearly the nurse has been nurses extremely well, knows exactly what they're doing and provides exceptional care, but they just don't want them because they're black.
Mm.
But why is the nurse being penalized for that? The nurse didn't do anything wrong,
Right.
right? And I've seen that where the nurse gets penalized because the patient they didn't provide care to the patient, despite the fact the patient doesn't want them. It's like, well, you must have did something wrong.
Yep.
No, it's because I'm black. Like, do you want me to rub hydrogen peroxide on my skin and make it better? Like, no, like that's not going to work. So listen to us. Number one. Number two. Um, like I said, when we come to a concern, when we voice to you, hey, you know what? When we applied for that job, why didn't I get that job? Because a lot of us too feel, yes, we're qualified, but sometimes we just don't get the job because of favoritism.
Hmm.
I've seen people in positions, and I'm like, really? How did you get that job?
Yeah.
How did you really get that job? I'm overqualified, but I never got the job. And also, be if you're going to promote us or you're going to advance us or anything like that, make sure you're doing that out of the kindness of your heart. You're doing it and being true about it. You're not just doing it just to, hey, we're hiring multicultural people and blah 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 blah. Because I've also seen that go the wrong way where they just
Or
do it for optics. Go on,
or
Donna. Go on.
or promote someone. This has happened to me. Promote me because nobody else wants to take that job because it's such a
Exact.
burnout job.
Wow.
Like
That is
Exactly.
not correct.
Exactly.
Those are some things you really got to take into consideration. So
Yeah,
mainly
you have to
we need
consider
people. We need to
workload.
start.
Like
Yeah.
I've had jobs where I've had double the workload of anybody else. I've had jobs where the team did not support me. I've had jobs where there's been internal sabotage purposely. I've had jobs where somebody has said, like another employee, another manager has said something completely gross and racist in front of my boss, and nothing happened other than me handing in my resignation. And so that's where the penalization is. Why is it that you can be in an organization where something that breaches your human rights happens and there is no action? And in order
Hmm.
to maintain your dignity and your mental health, you then have to leave that job and take a pay cut, right? And that's the penalization. So then you're off
Exactly.
track, you're off your pathway, you don't get to continue, you lose out on those
Exactly.
contacts, those relationships, those professional relationships,
Hmm.
and then you
Exactly.
get
And
ostracized and further penalization, and then you just don't get back. So I like technically I have permanently given up on any form of nursing management job because of the shenanigans that I've had to go through. I got to a point in this province that I put my picture on my resume because I got tired of coming from Ancaster to Toronto or wherever else and walking into the interview and seeing that
Surprise
face
face.
drop and the
Hmm.
negative feelings and me knowing, why am I doing this interview? They're never going to contact me again.
Hmm.
And it rings true, right? So it's very frustrating for
It
sure.
needs to be
and then
changed.
on top of that too, when you say something, sorry, I don't mean to just
Yeah.
to, again, last piggyback on Donna's point, but then when we voice these concerns, because these are huge concerns, we're oversensitive, we're overreacting, we're being mean, we're throwing the race card, we're all of these things. So it's like again, it's a vicious circle. It's like you get treated horrible, but then when you call them out on them treating you horrible, all of a sudden now it's your fault.
And that's
It's a vicious cycle.
and representation matters. Representation is the cause of difference, especially if you get
Your
the right
mic's
people.
doing the thing again.
So representation matters. You hear me now? You hear me good? You good?
It's still doing the same thing. I think it's your I think you had your headphones or something. I know when you took them off or you deactivated it was a lot better.
Can you hear me now? Can you hear me now? Is it okay? Are you
It's
good? Huh?
still it's still making that noise. It's okay. All right. So while he comes out, me and Donna will just kind of continue this in for the
Keep going,
meantime because technical
keep going
difficulties, but it
on.
is what it is. But
The
no, but
positive piece is the fact that community matters. Being connected in community matters. I did not have that in nursing until I came to the BNLC because I've been an RNAO member, I think 11 years now. It wasn't until the
yeah.
BNLC and that sense of community and being able to get that support, that sense that really, people are genuinely caring for you, giving you
Hmm.
advice, the members, when
Yeah.
we connect with them, that's that's really what has helped both of us
Hey guys,
Yeah.
can you hear
Yeah.
me now?
in
Are we back?
navigation
Are we
of
back together
of
in
We
the
this?
can
Okay.
we
space.
can hear you. Yep, we can hear you.
Perfect.
We can hear you.
Okay, we could stay from this. What I was saying there, like, what is the importance of what is being said? I know we're coming in because it took away from them a couple questions I have, but you know what? This is a really good start to really talk about the nitty gritty of what are the unknown of what nurses are really going through from the back end as the experience of what you're going through, right? And the importance of having being heard, right? The need to get to the tables where they listen to you, where the understanding of a black nurse is not a race card. It's not, you're dealing with it from both ends. You're dealing it from leadership who doesn't understand you. You're dealing it from
Yeah.
patients who want to chastise you and think that your degree is any less, or you can't do it just because of the color of your skin. When we all know, like, most black persons to get into that space have to work twice as hard to get where they are.
right? And so
Right,
Exactly.
right. So
Exactly.
my hope is that, with this additional focus, with a lot of organizations in the province doing their ABR training, and that my hope is that the situation will start to get better. Like RNAO has been working on the best practice guideline that for organizations that is going to be released in February. That's addressing ABR in nursing. So that's a very important document. There's lots of organizations that are waiting for that document to come out based on the reputation of all the other previously released best practice guidelines. And I think getting involved, you know, um, getting involved takes a lot of personal time, and personal time comes sacrifice, right? We
Mhm.
sacrifice our personal time to be able to be present at those varying different tables in order to advocate and do the good work, right? That it
Exactly.
may be sacrifice right now, but in the long term the sacrifice is very much well worth it.
I agree, and I think what is important to, and you actually hit the nail on my next question is that hope that you have for the future of Black nurses, and it's through that sacrifices that you guys are setting up at the trail as the trailblazers, and the work of Dania as past your president, and then the work of your current president, and all those are part of the interest groups. It really does allow the opportunity for policy change, because that's the only thing that's really going to change it. If the policy within it, or if it's taught more, if it's within the tenureship of learning to be a nurse, where you understand the differences of how it is to be treated as a Black nurse, or it is to be treated as a white nurse, or Southeast Asian, or whatever the case may be, those aspects needs to be taken into consideration. So my question with that is, as there may be some Black nurses or Black nurses in training that may come across listening today. And I feel that we didn't even touch palliative care, we didn't even touch intensive care, there's a lot that we didn't even get into today.
It means we got to come
I told
back.
you.
I'm gonna have to get you
We,
back.
we we just go on. I'm telling you, like we're
Luckily,
forced to reckon with.
luckily you did, because with me and the mic issues, right? You at least kept the conversation going while it was going in and out. But with that being said, for those Black nurses who are in training, what would you like them to take away today? If they were to hear this conversation and after all of it, right? Because we really showed the grievances of what we could go through, the hardships of it today. But after all of it, what would you like them to take away?
That we see you and don't give up, and we're here, and you can reach out anytime. Go to the RNAO page, go to the BNLC page. Our email is up there. Do not give up. You belong in that. You belong in those spaces. Black patients
Yeah.
want to see Black health professionals who can empathize with their
Yep.
experience, who can advocate for them, who can see
Yep.
those clear pathways, who can provide the health education and teaching to them. The referrals that happen for patients, it is inequitable for Black patients in this current
Yep.
healthcare system. When you get diagnosed with diabetes, why is there not a referral to a registered dietitian to be able to handle your diabetes with food as well as medication, and hope that you would get to a point that you are stabilized? That doesn't equitably happen.
Mm-mm.
And as a health professional, I got diagnosed with diabetes, and I did not receive a referral to a dietitian either. Right. So all the
Mhm.
stress and inequities with dealing with racism in our profession, if you don't take care of yourself, I can really quickly say I gained over 100 pounds because of stress and trauma. I've now lost 115 pounds because I'm focused on my mental health and my physical health, because I don't want to be on dialysis. I don't want chronic kidney failure. So we do, like, as Black nurses, we do have to take care of ourselves. We do have to prioritize ourselves before illness sets in,
Most
because
definitely.
once you don't have your health, you don't have anything.
Yep. And to piggyback off what Donna was saying, my simple advice, not simple, but try to make it simple, is don't let anyone else tell you that you can't do something that you know you can do. Okay,
Mm-mm.
so you determine your future, you determine what you want to do. If you want to get into nursing, if you want to be an NP, if you want to be a doctor, you need to be in an environment, and you need to be in an atmosphere, you need to be in a community that will encourage you and provide you with strive and just let you elevate. Don't let anyone else dictate to you and tell you how to do your thing and do your career when no one doesn't do it any else better than you. You know what you want. So don't let anyone tell you you can't work in a merge, you can't work in ICU. Why not?
Hmm.
You can't work in so no, why can't I? And also don't let other people tell you to do something because it's a stereotype. If you don't want to become a psychiatrist or work in psychiatry, you don't have to do it. Or better yet, if you just want to work in healthcare and you don't want to do sports or music or any other stereotypical um stream that we always find black people get pushed into, don't feel afraid to not say no. Right? If you want to be a doctor, if you want to be a nurse, guys, to the guys out there, if you want to be a nurse, go right ahead. Don't let someone else tell you, don't be a nurse. You're too big. You're too this. You should be security. No, if that's what you want to do, you do it.
Hmm.
To the black women out there, if that's what you want, if you want to get into nursing, if you want to get into medicine, you do it. Don't let anyone else do it. And then just one quick thing, again, I was just a shout out to a lot of black women out there. They're killing it. I'm telling you, PhDs and masters and stuff. They are changing the game.
Hmm.
So that's why I say to us fellas, we need to do that as well too. But that's my takeaway message. If you want to do it, and don't let anyone else tell you otherwise. Because we
Yeah.
need black nurses. We need
Yep.
them. Trust
And I
and
agree.
believe.
We need a representation. Representation in care is
Yes.
so important, especially in
Yes.
Community is important.
and the
Community is
community
very important.
knows what it is. So, guys, I want to say thank you so much for joining. And we're gonna have you back. We're gonna have to have you back. We're gonna have that discussion.
Yeah, there has to be a part two. There has to be a part two because
As far as we can go, there's so much more that we can dive into to really.
there's so much.
So thank you so much today, Donna and Dwight. I will be looking
Thank
forward
you.
to seeing you soon. And thank you for that message today. That exactly what you said, Dwight. Don't care what anyone tells you. If you know that you can do it, if you have the trust in yourself, trust in God, trust in whoever you may be believing, and just go forward and do it. And know that success will come to those who strive for it and who work hard for it. So thank you so much, guys. I'll be looking forward to hearing from you soon again. As for everyone up there, this is another episode of Black Health Unfiltered. I just really want to tell you, do not forget next Saturday, December 6th, is the fourth annual Children's Gift Giving event at Bladen's Public School from 1 p.m. to 4 p.m. That's Bladen Public School at 25 Bladen Avenue, North York, Ontario, where all children, if you're going to register, if you're going to bring your kids, they have to be registered. So all children must be registered. And for more information, you can reach out to 437-778-3299. That's 437-778-3299, or visit Love Bay's Instagram or their webpage at Love Bay Radio. Next week, we want to have a little bit of a twist of an episode coming for you. So I'm going to keep it as a surprise. Look out for the poster. And we will also get into more discussion. As I said, this is Dr. Akeem Stewart. Welcome. And thank you for listening to Black Health Unfiltered. And have a great week. And to close off, happy Independence, Barbados. Goodbye.